Being 5:15, I like to call a finance personnel meeting order. Please stand. For the pledge of allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Motion to adopt the agenda.
So moved.
Second.
Motion made by Mike, seconded by Tim. All those in favor?
Aye.
Opposed? Motion carried. Resolution declaring official intent to reimburse expenditures from proceeds of borrowing. Jason?
I'm not gonna say this is the last resolution I'm gonna bring to you guys. I think I did that with the last one. The DNR requested that we pull the lead services out of the downtown project and our 2023 water main improvements. So we're pulling all the lead services out of both of those projects and then we're submitting those separately. That's why we're seeking a separate resolution for that. And then that's supposed to be funded through the LSL program that our engineers submitted for. So that's why I'm requesting another finance resolution from you guys tonight.
Eventually, everybody's gonna have to have the lead services removed, aren't they?
Correct. We do have a lead service ordinance requiring everybody to remove the lead services or galvanized pipes. But we're not doing that unless it's a project or if the service would fail of some sort. So the lead is okay in the ground as it is now. We're trying to get our polyphosphates in place so we can inject those into the system and help with that lead as well. So we have several things in motion for that, but the DNR is a slower process than we are. You probably recognize and are wondering why the polyphosphates haven't been done yet, because we're supposed to do that, I think, 1.5 years ago already. We're set to do that, but the DNR's process is slow, so we haven't got approval. So we're waiting for the DNR to tell us it's okay and to move forward with that. So yeah, nobody has to panic. We're not asking any of the residents to immediately replace their lead service. They can if they would like to, but it's not a requirement from the utility. We're going to do it as needed. And we're hoping to get as much funding as possible. So we're going to put in place as much funding as we can possibly get for possibly 2025 is when we're going to start our lead service replacement program. So we're hoping to do a large portion of lead services in that calendar year.
And that makes sense. You got the street dug up, you might as well.
Correct.
Stuff now.
So that's why we're doing Quincy and
Sure.
downtown, because we're
what-
excavating, doing water main improvements.
Sure.
So then the services are going to come along with that.
Yeah, good idea.
I make a motion to approve a resolution declaring official intent to reimburse expenditures from proceeds of borrowing.
Second.
It's been made by Tim, seconded by Bob. All those in favor?
Aye.
Opposed? Motion carried. Move on to 2023 health insurance presentation. Amy Gelson, consultant, USI Insurance Services.
I'll bring up the power.
Thank you.
Thank you.
You should be able to flip those.
Wonderful. All right, I'll be in charge. You tell me when to move forward.
Oh, you are in charge? Okay.
Oh, no, you go ahead. I didn't realize you had a clicker. All right, you go.
Thanks, Jen. All right, good evening, everyone. Thank you for your time and attention. Today, we're here to discuss the proposal for our 2023 employee benefits. So first, we'll start out with the current situation. Robin Health Partners renewal came in with a 22% increase based on utilization as well as medical and RX trend. We do have that negotiated down to a 13.9% increase. Our loss ratio was high at 149%, which I'll get into in a second. But we do have an opportunity to offer multiple networks in order to keep the costs down. So we did do a full market analysis on the medical, and no one was as competitive as our current plan with Robin Health Partners. We do have a strategy in place to focus on population health management in the future, focusing on routine preventative care, which I'll touch on further in a second, as well as incentivized PCP engagement as a strategy in the future as well. As far as dental and vision, those came in with a small increase, but I was able to negotiate those to a 0% increase. So no change to the rates or benefit design on either of those benefits. So when we talk about loss ratio, what we look at here, we can take a look at the monthly summary, looking at revenue and claims. So this is looking at all paid claims through May 31st of 2023. If we take a look at the member count, we see that we have on average about 165 members, meaning 165 belly buttons on the plan. We then look at revenue. If you look at the revenue column at the 629,960 number, those are the dollars that are paid in premiums to Robin Health Partners for our current coverage. Then we look at that number versus claims, where you can see that Robin Health Partners paid out $935,646 in claims. So when you look at those numbers, they're just flip-flopped, whereas we get that loss ratio at 148.52%. So to make that very simple terms, what that really means is for every dollar that we're paying in premiums, Robin Health Partners is paying out $1.49 in claims. Okay, so that's what factors into our renewal increase. So to summarize our options with Robin, we do have multiple network options that we can focus on the cost savings on this sheet, and we'll focus on the providers on the next sheet. But we do have an option where we can empower the employees with choice to give them multiple network options in order to get our costs down. So employees can ultimately choose a network that works best for them by proposing 3 different network options. We do have high ThedaCare utilization, so this really does make sense as a way to have additional cost savings to the plan. So the first one is the broad network. That is our current plan that we have in place. That renewal was negotiated down to a 13.9% above current. We're also looking at offering a focus network, which is 4.7% above current. And to simplify that, that's really the same network that we have now with Ascension removed. And then we'll also be offering potentially a new Robin Select network, which actually is coming in at 6.6% below current costs, really focusing on the Bellin and Theta providers. Okay. So employees will really need to do their due diligence to make sure that the network that they're selecting makes sense for them and that the providers that they are seeing are included in the network that they are choosing. So here's a breakdown of those 3 provider networks being offered, and these would all be laid out in detail by a Robin representative during open enrollment meetings. So the broad network is the most expansive network that we're currently on. The focus is just like the broad, really just taking out Ascension. And then the Select network is really focusing on the Bellin and Theta with an in-network referral needed from a participating provider if they want to go to Froedtert or the Medical College of Wisconsin or things like that. Okay, so all of these would be discussed in further detail, but there are substantial cost differentials between the 2 or between the 3 networks. So let's take a look at the numbers and costs. We currently, if we look at the far left side up on the screen, we look at our enrollment. So we currently have 17 employees on the plan, 42 families on the plan for a total of 59 employees through on the renewal. If we look at current, you can see in the middle column, it shows our current premium rates. Far right side looks at the different network options. So plan 1 on the renewal side shows the Select network coming in at the 6.6% below current that I talked about. The Focus network in the middle, located under plan 2, coming in at 4.7% above current. And then under plan 3, that broad network, the current network that we have in place, coming in at that 13.9% increase. And then on the slide, here's the city's proposed breakdown from a rate standpoint as well as by network. So you can see on the upper left-hand corner, we look at the current 2023 rates with the premium rates for each network illustrated to the right that we just took a look at. And then in the middle section is the proposed contribution breakdown. So we're looking at having a base plan based on the Focus network where the city would contribute, the employees would contribute 4%. If they decided that they wanted to keep the current broad network that they're on, which is the most expansive network with Ascension included, they would pay 11.68% of that. And if they decided that that Select network made sense for them, there would be no charge to the employees. Plus they would have an additional HSA contribution of $500 for a single, as well as $1,000 for a family. Okay. So you can see the breakdown in the monthly single and family rates based upon the three networks in the middle, looking at the employee cost for 2024, as well as the cost that the city would be paying across all three networks. And I briefly mentioned HSA contributions. So the city would continue to contribute $1,000 for a single and $2,000 for a family into the employees' HSAs for those that elect the broad and the focus network. For those that would select the select network, they'd get that additional $500 or $1,000 into their HSA for a total contribution from the city of $1,500 for a single and $3,000 for a family. Okay. And then another big continued focus would be on population health management as a great way to keep our costs down in the future and to really manage trend, as well as have a better return on investment from our overall plan utilization. So we talk about why wellness and preventative care and regular preventative care is so critical to maintaining good health and to managing our healthcare spending. Preventative care is covered at 100% on all three plan network options that would be offered. The shocking statistic is that 70% of the population does not have an active primary care relationship, meaning they don't even go in for the routine preventative care. So we really want to make sure that all employees are engaging with their primary care physician, getting their regular preventative screenings that they should in order to make sure that conditions are caught early and so they don't turn into more chronic, serious, costly conditions in the future. So we really all need to work together to fight the rising healthcare costs. And these are some additional educational pieces that we would be reminding the employees of. The first one with Robin Healthcare is just a reminder to get your routine preventative care. So this outlines the routine preventative services that are covered at 100% by Robin, which we would go into in great detail with the employees. Also reminding them to get engaged with their primary care physician. And then we also have the $0 cost preventative drug list. So we really want to make sure that employees that are taking routine maintenance medications or preventative drugs are fully utilizing the free drug list that is available by Robin Health Partners in order to keep costs down for the plan, as well as to keep additional dollars in their pocket as well. So another great education piece, which we would be discussing in great detail with the employees. And then we talk about the impacts of connecting members to their PCP. So really reducing inefficiencies in the care settings can really help manage our numbers and intensity of services consumed, ultimately leading to 3 to 5% reduction in healthcare claims. So if we look at this study, the gold line in all 4 quadrants represents those individuals that did not have preventative care within the last 12 months compared to the blue line, which illustrates those individuals that did have their routine preventative care. You can see in every category, inpatient admissions, emergency room visits, average length of hospital stay, and hospital readmission rate, that all rates are substantially lower just simply by going in to get your routine preventative care, ultimately proving that prevention really does save trips to the hospital. And then if we dive into cancer care management specifically, this chart really hits home for a lot of people. So the left side looks at the cancer type. The middle looks at the cost of the screening compared to the average cost to treat cancer, and then the estimated survival rates. So if we focus on the very bottom line, let's look at breast cancer. We look at breast cancer, the cost of a mammogram is about $291 compared to the average cost to treat breast cancer at $141,000. More importantly, for everyone's well-being, if we look at the survival rate, if it's caught early, stage 1, that survival rate's approximately 100%, goes all the way down to 22% caught stage 4. So we cannot encourage employees enough to please go in for the routine preventative exams to make sure they're getting those appropriate age and gender screenings. And then we do have additional educational support that we would be putting behind this just to push that preventative piece and the PCP engagement. So we do have monthly newsletters that are sent out by USI on wellness topics. These can be shared with all of your employees, and we would highly encourage you to do so. In addition to our monthly wellness newsletters, we also do have a bunch of educational videos that can be linked by a URL link that employees can have access to, which in our open enrollment materials, we have multiple educational videos built into that as well. And then we also have additional enrollment communication support. So just a reminder, that we do have our mobile app available through USI. So I'd highly encourage everyone, if they have not yet done so, to scan this QR code and to download the app. This will house all of your benefit information, carrier contact information. You can have your ID cards on here and everything. Really nice for dependents as well. So it's another great tool that we have available to help educate employees and to keep all that information in their hands at all times. We also have our Benefit Resource Center. So just a reminder that this is our concierge service staffed by USI employees. So if employees have any questions about billing issues, they need to go through the appeal process. Our USI staffed concierge service will take them through that process and orchestrate the conversations between the provider and the insurance company to get everything worked out. So I'd highly encourage that they take advantage of that if they have yet to do so. And last but not least, for anyone that is approaching that Medicare age, we know that can be a very stressful and intimidating time. So we do have Medicare resources available to all of your employees as well. So if they would want to take a look and evaluate the current group plan that they're on compared to what Medicare options are available to them, we do have Medicare associates that are able to help and assist in that process as well. And with that, I will wrap it up and say thank you so much for your time and attention.
I have one question.
Yes.
Do they pay for your like preventive, and we're big into preventive care? Do they for like flu shots and all the other shots you get? They pay for all those?
Yes.
Okay.
Yes, it all comes down to how your doctor codes it. So if it's coded as routine and preventative, it would be covered at 100%.
So if you want to go back to the page, Chad, or maybe where we're talking about last year's plan versus this year's plan.
Mhm.
So ultimately, tonight, what we're looking for is the committee to take a look at the recommendation to offer the employees 3 different plans going into 2024. Keep in mind, our renewal is up on October 1st. So the next page, please, is a chart that was put together showing the 2023 plan versus the 2024 premium rates. And again, the current plan is the broad plan. So when we sat down, there was a number of us that sat down and we went through this information, Chad, and then Jay from utilities, myself and Jamie. When she initially came in, she had went through some initial rates. And I think one of the things that she skipped over to when she started was that we wanted to make sure that there was the due diligence that she looked at other carriers besides Robin. And she had a number of them listed on the first page that wouldn't even think about quoting the city, because as she said, we are spending $1.48 on every dollar that they're taking in revenue. So then, we had a number of meetings and talked about where do we want to go from here. So one of the things we are looking at to control the cost for the city of New London was we have a contractual verbiage with our current, correct me if I'm saying it in this, with our current contract with our police department, our representative employees. And we pay up to 96%. So our consideration after we had some discussion about how many people are actually utilizing the broad plan versus the focus plan or those physicians within those environments. The majority of people would actually not benefit from going down, but would be in the group of physicians or healthcare providers that are in the focus group. So we're like, okay, so we could save some money if we look at 3 plans, and what would that look like? And so what I did is I did a little calculation of if we offer the focus plan at 4% and then upcharge for the current plan, so that, as you can see at the bottom, the city is paying exactly the same out of pocket for both the focused and the broad plan. So the city is offering a base plan of focused at 4%. And then it would be an upcharge to the employee. So in a single plan, you go from 28.11 a month to 89.21 a month. But at the end of the day, what I was trying to equalize out was that the city was paying the same dollar amount for the plan on the focused versus broad, just to kind of explain this, what this looks like. Then on the select plan, in order to encourage employees to select that plan, there's no way they're gonna select that plan at $28 a paycheck unless you give them incentive to move there, which would be a large savings for the city. So we looked at what would that look like? So offer them a zero contribution and then an additional $500 into their HSA plan and $1,000 addition for the family insurance. So those deductibles are $3,000, $6,000. So currently we pay $1,000 single, $2,000 family. So the employee is paying $4,000 and a single plan is paying $2,000. So this would just help those individuals have a little less gap within the high deductible health plan.
Do the insurance companies say you get into the select plan, and I mean, that's your healthier people, obviously. If you get into that plan and say you start having a lot of unhealthy people for whatever reason, will the insurance company kick you out of that plan? They won't. They just raise the premium would probably go up the following year then.
The premium would reflect that upon next renewal based upon utilization of the plan. But the select option could be a very good option for those very low utilizers of healthcare, or for all those individuals that may not even have a PCP established or have a doctor that they have selected. So that would kind of steer them into that network to make that deciding factor in order to save additional money on the premiums and have that zero healthcare plan. So it could be advantageous for many, given that factor.
Explain to me why the select plan would be better for healthy people and not better for someone who would have a pre-existing condition or something.
And when I say healthy, I just mean that they don't necessarily utilize a health plan at all. So they may not be utilizing any of the insurance that they have in place currently today. So if they're a low utilizer of healthcare, they don't have a provider established, they're open to going anywhere, the select network could be a very viable option. So it doesn't necessarily have to do with healthy, unhealthy, it has to do more with utilization.
Okay, and I guess I'm a little confused on that, because when I look at the three plans and what they have for deductibles and the embeddeds and the out-of-pockets and the co-insurances, they're all kind of the same. What I'm really seeing as a difference is where they can go.
That is 100% correct. So the actual plan details itself are all exactly the same. It's all the $3,000, $6,000 deductible with 100% co-insurance with a max out of pocket of $3,000 and $6,000. The only differentiating factor is that we're giving the employees choice to determine which network makes the most sense for them and to have potential cost savings tied to that network.
So if ThedaCare, someone who already utilizes ThedaCare, the select plan would be the plan to go to, pretty much in what I'm looking at as far as the individual's out-of-pocket expenses.
So if we look at the network options here, I think this is a good illustration. It shows the broad being the most expansive.
As far as providers.
As far as providers, the focus, the major differential here is that Ascension is removed. And then Select is really just Bellin and Theta and Children's of Wisconsin and Holy Family. And then if you do need to go to Freighter or the Medical College of Wisconsin, you do need a referral from an in-network participating provider. One of the differentiators here is that the Broad and the Focus have the Cigna National Network, whereas the Select does not. So the Select is more of a true HMO, that it doesn't have the Cigna nationwide wrap like the Broad and the Focus do, which ultimately plays into that substantial cost savings as well.
But the people could take whichever one they want, providing they're willing to pay the additional premium.
Absolutely. So the rates that we have proposed that Judy outlined are based on the Focus Network being the base plan with that 4% contribution by the employees. And then if they wanted to take the broad network that is currently in place, which is the most expansive network, that's where they would have an upcharge at the 11.68% compared to the 4%.
So basically, if they're already working through the Ascension network, they would want the broad plan.
Correct. If they're happy with Theta and all their doctors are through Theta, that Focus Network is a perfect solution. And if they really even want to squeeze it a little bit more and are comfortable with the Select is a good option as well.
And when you looked at it, we didn't have too many employees with the Ascension groups already.
That is
Most
correct.
of our employees would be in a network that the Focus or Select would be suffice for.
So based on utilization reports that we do receive, the majority of employees are receiving care through Theta Care, which is why that Focus and Select network is a very attractive option.
So by doing this, you said that the renewal is going up 22%, but you're proposing we're passing on the increase to the employees to pay to offset the cost.
Correct. So the middle, the Focused is going up a little less than 5%, right?
4.7%.
4.7, but because the broad network was going up almost 15%, you are correct. They would have to pay the difference so that that one also would reflect in the less than 5% increase.
So ultimately, at the end of the day, the city is not having an increase in benefits
It'll be about 5%,
or 5%.
which is a very small increase when you're looking at health insurance.
That's better
And it
than
could be
22.
less if people take the Select. That's zero to, it's actually negatives, even if,
Yeah, it's negative 6.6 on the Select.
Nice.
So depending on where employees migrate, that could positively impact the rates even further.
and I think what happens too is when you're looking at the broad, you don't really want to pull it out because you may have some people who are currently doctoring with a Select, I don't want to use that word because we have it up here, but a particular doctor. And if they're willing to pay the difference in that, keep us in that less than 5% category, I think it's just a good option not to pull off the table at this time anyway.
Employees like to have choice. So empowering them with the choice based upon the providers that they utilize will be a welcomed option.
Any more discussion? Can I get a motion?
Make that, excuse me, I'll make that motion if I can talk.
Second?
So clarify the motion for me, please.
Yes, please.
It's a motion to accept.
We have to send this to council, correct?
So basically, the motion, we're asking for clarification of what the motion is. The motion is to accept
the whole
the,
presentation.
that page 7 as the premium options, the healthcare options for,
Correct. Not to speak on behalf of Bob, but the motion would be to accept and offer the health insurance plan for the 2024 cycle with the 3 options of Select, Focus, and Broad at the numbers that you saw in the presentation.
Sounds good. I'll make that motion.
I just thought
I didn't know what we were. I
be a
needed
little
that
more
clarification.
specific. So
Yes, I mean, this is the plans that we're gonna offer. Well, and
With the three,
actually
with the
as
three
of
options.
next month. because
Correct.
the cycle starts as of October 1st.
Correct.
Yes,
With the three options.
yes.
And employees will have that choice,
Yes.
as we discussed. Okay.
That's the motion I make.
I will second that motion.
That will still go with the council, right?
Right after this.
A motion's been made by Bob, seconded by John. All those in favor?
Aye.
Opposed? Motion carried. Thank you, Jamie.
Now, if there's
Thank
any
you.
questions for Jamie yet, she's planning on leaving before the council meeting at the end. So if there's any additional questions, ask now before she leaves.
Thank you.
Thank you very much.
Thank you, Jamie.
We'll move on to the 2022 audit presentation by Brent Nelson, CPA partner Johnson and Block and Company.
Brent, can you hear us?
All right. Yep, I can hear everybody fine. How's my volume?
You
Coming
are
through.
phenomenal. I'm actually gonna turn you down a little bit, so, but we're good.
Okay. And here momentarily, I'll share my screen, but I believe the PowerPoint went out with the board packet, the one I'll be using tonight, in addition to, I believe that, 80-page 2022 financial audit report. So my plan tonight, or I'll quick introduce myself if people aren't sure who I am. I've attended Zoomed into meetings in the past, but Brent Nelson, I'm an audit partner with Johnson Block and Company. I'm reporting on the 2022 audited financial statement. So here I'm going to share my screen, and feel free to interrupt, or if questions arise, or otherwise we can go over some questions at the end. All right. And hopefully that share is coming through.
Yes.
Okay. Yep. So here we issued the 2022 audit in mid-August. So a little bit later than it had been in the prior year. We had some turnover at Johnson Block. So apologies. I think typically I'm here the first meeting in July or the first meeting in August. So, but that was Johnson Block side, just with some turnover working through that. Quick overview of the audit of 2022. So hopefully everybody got a full copy of that, or at least electronically, that 2022 audit. In our audit report, we issued unmodified opinions, unmodified, better known as a clean opinion. So basically, we feel the financial statements in that report are in accordance in all material respects with generally accepted accounting principles. So that's a good thing. Prior to us going final with the audit, we sent a draft to management, give them an opportunity to review and approve that report before we went final. In addition to the audited financial statements, there's a standard communication report we issue to the board, or to the city council. So I encourage you to read through that. I'll maybe touch on a little bit later if there's any questions. Something new for this year was, due to the amount of federal expenditures flowing through to the city in 2022, the city is required to have what's called a single audit. And that's basically an additional compliance audit on some of the major federal and state grants. So specifically the two big CDBG grants that flowed through for the trail and the infrastructure work that was done. Historically, the city has always been below that $750,000 threshold, but with those, and it's not just the city, but with all this federal funding going around, we're seeing a lot of our municipal audit clients being now subject to these single audit procedures. So we started that process, looking to wrap that up here this month. Some quick 2022 financial highlights. The governmental funds of the city. So the city has multiple, 15, 20 different individual funds, governmental funds. Overall, looking at across the board at all funds, there was an overall decrease of about $747,000, but broken down at the fund level. Some notable funds that changes: the general fund for 2022 decreased $134,000, $135,000. And the primary driver of that was with some investment decreases in fair market value of some of the investments that the general fund had. So that was 2022. I haven't looked at 2023, but I'd like to think that those investments have rebounded. But for 2022, across the board investments were down. So that was the primary driver, that general fund decrease. Capital projects fund is another large fund of the city, decreased about $1 million. And that can be a little misleading. Based on timing of when debt is issued and when those bond funds are spent, can lead to big swings in the capital projects fund. So that decreases the city spending down debt proceeds is a primary driver of that. The library and museum fund increased $522,000 in 2022. I know they've been active in fundraising in that fund for the last several years. TIF district number 5 was relatively new TIF district with decreased in fund balance at $265,000 for 2022. So TIF district number 5 is so new that it doesn't generate its own revenue. There's no tax revenue generating, at least not in 2022. I know that that'll hopefully change here in the very short term, but in 2022, that decrease is all expenditures being incurred by the TIF district that haven't yet been recouped by revenues or bond funding. And I know in part of the 2023 borrowing that the city did this spring, summer, I believe a chunk of that went to TIF district number 5. Which will help that fund out. Debt service fund increased $102,000. So there's build up a little bit of a reserve in that debt service fund. The general fund on an overall basis reported favorable variances. I know I mentioned the loss above, but except for the investment losses in 2022, actual revenues exceeded budgeted revenues. So with that exception, the general fund revenues were doing well compared to budget. And likewise on the expenditure side, actual expenditures were coming in less than budget. So other than that investment loss for the year, everything else was shaping up well with the budget. Looking at the utility side of things, so the electric and water utility increased about 1.2 million. And then the sewer utility decreased 178,000. So the sewer utility also had some investment. There's some investments in the sewer utility that also had a loss in 2022. So hopefully those have rebounded in 2023. And then I believe some new sewer rates went into effect in the first part of 2023, which will also help out that sewer utility loss. Just focusing solely on the general fund, because it gets the most attention. This is a 5-year trend of how that general fund has looked. So at the end of 2022, the general fund balance was roughly 6.5 million. And it's overall, the general fund balance has been pretty steady over the past 5 years, hovering from around 6 million to 6.5. So of the general fund balance, 3,683,000 of that is what was deemed unassigned. So a lot of the general fund balances is earmarked by the city for specific purposes. So all that 6.5 million isn't discretionary. But the unassigned portion is about 3.7 million. That represents approximately 53,000 of 2022 general fund balance. And we always look at that ratio because the city like most municipalities has a fund balance policy that they want that unassigned fund balance to be a minimum of 25% of annual expenditures. So and the city was well above that threshold, that minimum 25% at that 53%. So even with that loss, those investment losses, the city still has what I'd say is a healthy general fund balance. Just looking again solely at the general fund, a 3-year trend of revenues, what makes up the general fund revenue. So the biggest piece of general fund revenue is property taxes. 46% of general fund revenue was local property taxes, about $3 million. And that's pretty steady with where it's been the last couple of years. So 46% in 2022, about 44% the last couple of years. So that's the biggest piece. The second biggest piece is intergovernmental revenue. And that's been really flat, these last 3 years, but if I extended this out, it's been flat, for many years, and it sounds like that's going to change here for 2024 and going forward with this, the state passing Act 12. So I know this intergovernmental revenue has been flat for a long time, but we're hopefully looking to see some increases in that in 2024. I mentioned the investment losses that the general fund had. So that's that negative number there. And you can see that's a big, it had been over 200,000 of income, all of a sudden turned into a deficit, a negative number. One other thing I thought I'd point out, so the public charges for services. So in 2020, that was only 241,000. And you could really see that rebound coming off of COVID in 21 and 22. So looking at the expenditures, likewise, another 3-year trend in general fund expenditures. Overall, general fund expenditures have been pretty steady in total, around $7.4 million in total general fund expenses. And likewise, what's been steady is just the breakdown. The general government spends 16% of the total budget, and that's steady with prior. So overall, things have been pretty, no big swings that we're seeing there in the last year-over-year changes. Biggest part of the general fund budget is public safety, 35%. So your fire, your police, things of that nature. Couple increases we saw in public works and in culture and rec, leisure activities. And we know the city hired some full-time people, kind of separated some positions out in 2022 and hired some full-time people. So we saw some increases in expenses in those functions. Changes in long-term debt. So overall governmental activities. So this would be the general fund, capital projects fund. So at the beginning of the year, had about a little over $10 million of $10 million of debt. There was no new debt in 2022. I know that's changed in 2023. There was a big debt issuance here in the last couple months, but relative 2022 was a pretty quiet year on the long-term debt, just continued pay down of existing debt. So at beginning of the year, about 10 million down to about 9.5, 9.6 million at the end of the year. So that's the governmental side. So the business type activities, that'd be your utilities, where they're not funded by taxes, they're funded by electric, water, sewer user charges. So no new debt in the utility funds in 2022. And at the end of 22, about $15 million in utility debt, of which about $5 million was sewer, about $10 million was electric and water. One thing we always like to point out is that the state of Wisconsin sets a limitation on how much debt a municipality can issue. For the city of New London, as of the end of 2020, or for 2022, that limit was almost $25 million. That's the general obligation debt limit. So the city could not borrow more than that. And this, in comparison to what the city has actually issued, is about 9.7 million. So there is capacity there that the city could issue more debt and still be in accordance with state of Wisconsin statutes. So, and I know, even after the $3.4 million of debt was issued here this spring, summer, that the city still does have debt capacity in accordance with state statutes. So just to kind of wrap up, overall, the city, as I said, I believe the city has a healthy fund balance. It still has borrowing capacity if the city ever needed to borrow more money, or for projects that coming up. During the course, as always, during the course of the audit, we received full cooperation from city personnel. We work with various staff across departments for the audit, and they're always very helpful. And appreciate you letting us be of service to the city. Any questions or anything you wanted to specifically ask me on the audit?
Doesn't look like anyone has questions, I guess.
I guess I could comment on a couple of things that Brent did talk about when he went through the audit. He talked about the general fund decrease of 134,000, and like he had mentioned, most of that was a reduction in our fair market value of our investments, of which he said he probably figures they're all back. Well, they are all back, just so you know that. I'm not saying that I have a crystal ball that says that they're not, they may or may not. Again, go back down, but for the time being, they have replenished, and you know that you've seen the interest from month to month that I present, and you can see that our interest is actually up immensely this year compared to last year. So those have been recovered. Also, the capital projects that he did speak about, even though it looks like a very large dollar amount at $1 million. Yes, those are bond proceeds that we still had remaining and projects that we were still completing. So that's why it was $1 million. But as we also know, within our capital projects fund, $1 million is not a lot of money. So you're probably going to see that kind of spending going from year to year now anyway, with all of the road construction and everything else within our TID districts that are going on right now. Also the utility, he did talk about that decrease. Yes, two things are happening, though the fair market value of that investment also did rebound. And we do have the sewer rates that were increased as of the beginning of the year. So we should see that rebound from that also. Otherwise, I think those were the only things that I had earmarked as I went through. Any other questions of Brent? Do you have any more comments, Brent? Anything else you wanted to bring up?
Nothing really specific. I did reference there's a separate audit communication document. Most of it's standard communication, but it talks about some new accounting pronouncements that are on the horizon. We did have a recommendation to increase the capitalization policy, which it sounds like Judy's, if she hasn't already, has that on the radar to do here, just to align with federal guidelines. But TIF districts, yeah, you got 3 new TIFs, so they're going to have a lot of activity. We did have a recommendation, if TIF eligible costs are being incurred, make sure they go to those TIF district funds. If it's staff time, some of that is allowable to be charged to the TIF district. So just being cognizant of that city staff time can also get charged to TIF districts as well. But so that's kind of what's in that audit communication document, things like that.
So what he's talking about is currently we capitalize our fixed assets at 2,500 and federal is now at 5,000. And Chad's going through that codification program, and we had some discussion about other policy that isn't quite matching other things. So I said, as we go through that, we're going to be doing some updates. So we would definitely look at that as part of that update to get everything on the same playing field. And then I'm sorry, what was the other thing that you talked about?
The TIF districts and making sure you're
Yep,
capturing
so
those
I have
costs.
already sent out, as Chad can attest to, all of the people who are involved in those TIF districts, Dave, myself, Chad, Nicole. I sent out an email to everyone to keep track of when they are working on TIF districts, so that I can move those dollars over into those districts as they're working on.
All right, thank you, Brent.
Thank you.
Thank you, Brent. I'll talk to you about the single audit soon.
Yep, we'll be in touch.
Sounds good.
All right, thank
Have
you.
a good
Take care.
evening.
You too.
I will move on to the finance director's monthly reports. Judy?
All right, so, oh,
Number
wait,
6.
I must have missed that one. So number 7, we have to, I think I missed that one. Set the
Oh, you did.
presentation, yep, so I'll let you see.
All right, the consideration of wages for commission, mayor, council, and poll workers.
I think I'm taking that one. Right?
Yep.
Yeah.
So it was asked that the city review compensation for the mayor, council members, poll workers. We also in the last month had another request regarding payment for commissioners for our commission. So there's going to be 4 things we're going to talk about: mayor, council, poll workers, and committees, commissions in this discussion. So just to start off with, so everybody kind of knows where it's referenced. If you go to the municipal code, chapter 2. That's where we see in the code where it says, where it talks about compensation for all the persons, mayors and the attorney. Obviously, the attorney is an elected attorney, so that has changed, but this is where it's indicated in the code in chapter 2, what the compensations are for the mayor and all the persons. Also talks about where the meetings are, the compensation for attendance for the meetings. In here, and I'll kind of get to this a little bit later, but it references citizen members, that the citizen members in the Parks and Rec Committee and Economic Development Committee are compensated for their meetings. However, down here, it specifically calls out the Planning Commission. Only elected officials are eligible for additional compensation, no citizen members. So it's kind of weird. There's not any rhyme or reason that I know of that why some are compensated and some are not. And we're getting a question on why are, Parks and Rec Committee citizen members, Economic Development Committee citizen members are paid, not Planning Commission members. I think we'll get to that in a little bit. But I think what I want to start the conversation is directed to reviewing the mayor and the alderperson compensations. Now, one of the things I also want to highlight here in subsection 4, the fiscal year for compensation of elected officials begins with May. So it's my, I guess, unlegal perception that whatever changes you guys make, that would be enacted in May when the new election turns over. Just kind of a couple little tidbits before we go into this. So in your packet, we did some research about what alderperson and mayor pay is. You can see here the highlighted line, which is also indicated in the municipal code of $3,000 a year or $30 a meeting, and $30 a meeting. Plus, if you're a chair, you get $35 for presiding over the meeting. And it's kind of all over the place, but you can see there's other communities where I think Paca was one of them. I'll highlight to there. They have a annual stipend of $48.50 per year, but they don't get any meeting pay. So there are some communities that just give their annual lump sum stipend. I'm assuming they break it up into every other week or monthly payments, but there are some communities that have just the stipend, and some communities also pay the attendance per meeting. And then also in your packet, the mayor was kind of all over the place as well. We have some towns that are also recorded in here. Again, some of them like in Oapaca, quite a bit higher on the annual stipend, but no meeting attendance pay with that as well. And I guess just to make it kind of simple, I guess let's target on this first before we get into the poll worker pay. Not sure where you guys want to go with this. This is the evaluation that we came up with what different communities are making. I think you're right now, from what I see, you're at the level below, below center of what the average is or what the other communities are making. Looks like 35 per meeting, 20 per meeting, 40. I don't see too much more than that 30, 35, and that's $140 for attendance per meeting, at least for alder persons. They're the same thing, $35 a meeting, $20 per meeting, 20, 40 for special, 20. So
I was just wondering if you had any history on when the last time there was a wage study for this.
not sure, but I can tell you that the ordinance right now calls or states that this should be the pay as of May 1st, 2018. So what I can tell you, it hasn't changed since 2018. I can't tell you before that when the last change was.
That was in Gary Hank, he had that, he wanted us to get paid. I cut down the yearly pay, like paid us to go to meetings because he thought paying per meeting would get more people to go to meetings. So that was that was in that 2018 deal. That was the last time we had it was a raise, actually, it was a raise. That's the last time. That's the reason for it.
I know the chair gets $5 more than just a committee member, I thought that was kind of a joke when I first got my first paycheck when I was chair of economic development. I was like, really? I mean, you put in so much work to the meeting. So I think that's kind of low, $5 just to be the chair. Otherwise, I mean, Greenville's up there. You know, when we did our employee study, we did 92% of Grand Chute, 92% of Greenville.
I don't know, my personal feeling is, I don't think anybody takes these jobs for the money. I mean, that's my personal feelings about it.
We also are having people not taking these jobs.
Yeah,
I mean,
but-
we
and
haven't
I-
had a contested race in a long time.
And I don't know if what you'd have to raise it to get more people interested in it. That would be an incentive, possibly, I don't know.
I know the council used to get $4,000 a month, but then they didn't get nothing for coming to the other meetings.
Now, that was when they changed it to
Yeah.
what it is now.
Basically, when I look at it, I look at the final figure. And I don't think we're below people really. When I look at that final figure, what you can get by attending all the meetings, I figure we're right in line with everybody else. Our size.
I do agree with Tim in a way about a chair getting $5. I mean, not because I'm a chair, but I mean, I do think that's not much of a compensation for being a chair. I mean, that's just my personal feelings.
There are numerous times where the chair comes in and, you know, Dave, Tim, Bob, you guys have come in as the chairman, talk about agendas, talk about things. Those aren't extra compensated. It's not a committee meeting, but you are doing the work outside the meetings as chairman.
How much extra time does that take? Is it an extra hour per month?
Depends on really what's on the agenda as far as for that month. Sometimes I know
I've had multiple meetings on stuff
a month, yeah.
in a month. It all depends on where we are. I don't care, that's part of the job, but I would hate to see the base go up, but I could see the meetings going up because I actually agree that. Yeah, it's not we don't have a whole bunch of people running very often, but we need to make sure that we continue to get people involved. And if it's us 10 councilmen, then that's what it is. But we need to be at the meetings. You
For
know,
example, budget time. I know we meet several times going over the budget before it's presented to council or committee. Same with the health insurance.
I mean, I guess I'm just kind of looking at this from the standpoint of, you know, $5 per meeting doesn't seem like enough. That's not even enough to say this is what I want on the agenda, in my opinion. And I'm not a chair, so I get to speak freely about that. I'm going to agree, that's not enough compensation and needs to go up. But then what is an appropriate compensation if you're going to look at the number of hours that are, and I understand it varies from time to time. Finance right now that, you know, there's going to be a lot more going into that. We're going to see a lot more of those meetings as well. But that's a lot of work. The health benefit stuff is a lot of work. Just sitting and talking, you know, the planning commission regarding everything that's going on downtown, that's a lot of work and it needs to be compensated. So taking a look at the hours that are put in and kind of averaging that out and saying, this is what, you know, we'll pay for chairing. And some months it's not going to be a lot of hours put in, but other months it's going to be way more. So kind of average that out. But I don't know what those hours are to say that, I mean, I don't know, is $15 extra per meeting enough? That still might not be enough compensation. I just don't know because I don't know how much work is put in.
I'd just like to make a suggestion to be on a small percentage. Keep up the same pay scale as what the city staff does. I did some quick math and I mean, overall, it's keeping up with wages. A little different than what you were talking about as far as chair.
Yeah, I was specifically addressing the chair having an additional increase over whatever we would decide for compensation for the actual members attending the meetings. For elected officials attending the meetings. I kind of feel like that needs to go up as well, but then how much more does the chair need to be compensated? I feel like they need to be compensated way more than $5 per meeting.
What are you thinking?
That's my question. I don't know. I would, my thought is to say, and I guess we have time to figure this out. How much time over the course of a year extra do they do for those meetings? And then take that average based on, you know, an additional compensation. So I don't know what that should be. I mean, if they're putting in an hour per meeting, on average, I think $5 an hour is certainly not enough. And, you know, they should be getting at least an additional, if that's the case, my thought would be at least an additional 25. That's my thought, but I don't know.
I think that would be fair to say an hour a month. Chair puts in at least.
So I mean, right now we spend $73,000 on mayor and council. If we get an extra $1,000 per councilman, an extra $2,000 for mayor, I mean, that's 24,000. I mean, we're up to, I mean, that's like what? 15% increase. I mean, that's kind of what the employees of New London got at the last wage study. And like, I mean, you look at what Lebanon, they were to what, 5,000, I gotta go back here. And they're unincorporated. I know it's all over the place, but like I said, we have, you know, even if I'm not on council, I would like the best of my, you know, a resident in my district representing my city. And right now we're having a hard time finding people that want that position. So maybe, you know.
I don't think the average person realizes how much time is actually involved by this group. You know, they only see us for an hour here and there if they're watching, you know, the stuff. But there's a lot of stuff behind the scenes that's going through the conversations, text messages, whatever they are, to make sure we're up to speed and everything. So one thing I would say is, I don't like them towns that don't pay for the meetings and just give a bigger sum. I think you should be rewarded coming to these meetings, because not that that's the reason you come, but I think it's an incentive to stay involved, you know.
To be educated when you are sitting there making
Right.
the vote.
To capitalize off what you say, I do keep a history and a log and mental note of who attends what, when, and that such. I think we're very unique here. Most of our alderpersons, I should say, just about every alderperson makes almost every meeting. And I pride myself on that, the knowing that you guys show up to.
Okay, so I just did a quick math, so I'm just gonna say this out loud. It's not like what I'm just trying to put some numbers into something. So if you do $10 more a meeting, correct me if I'm wrong with what I'm talking about here, right? $10 more a meeting for just the regular attendance. times 6 meetings times 12, right? So possibility of if you attend all the meetings, you get times 6 times 12, that's $720. And if you add $15 to the chair, does that also include 6 meetings? That'd
No,
be-
that only. that's
Only the one you're
when
on.
Shared the meeting,
It'd be one meeting a month.
one meeting.
So by 1 times 1 times 12. So that's only 100. So you could go, so you're at 720, if you're talking $1,000, so then you're only at 180 and 720, or you're right at 900. So maybe you want to be a little more generous with the chair. And so that's just, I'm just trying to give you some, so if you went $10 more a meeting because you want to encourage attendance, 15, maybe $20 more for the chair, you're gonna be within your $1,000 that you're talking about. Or increasing on the 15% on the council side. Does that make sense? That making sense?
That makes a lot of sense.
And then you would do the same thing on the mayor side. So again, you want him to attend, so you would encourage the attendance side of his to increase it by 1,000. So whatever that would turn out.
I misspoke. I was actually thinking more of 2,000 because 2,000 times 10 is 20,000. So what if you increased it to 4,000 a year, $40 a meeting, $60 for a chair? Then that'd be more around the 15% increase, like what the city got.
What did the city get? I thought they got like 4.5.
Oh, it was all over the place.
Yeah,
So
he was talking about.
But in
The
average.
wage adjustment last
Yeah.
year.
Yeah.
I mean, wages have doubled in the last 3 years. I know people working at McDonald's making $15 an hour.
Starting.
I mean, I do agree with Mayor's comment that I think on a yearly basis, there should be an increase of maybe a percentage of match that we're giving the employees. Because that way, if you just stay on top of it, just like we're talking to our employees, you stay in the median to be average.
I also want to bring up the point that the only reason I brought this up is because of the increase in shared revenue. We're gonna have the extra money, so I'm not just doing this because, but this is the time.
So Judy had some nice solid numbers and what you were talking about, what your suggestion was double that.
So if you want to encourage attendance, you stay away from base. And you give $20 more a meeting and $64, so you give $50 a meeting. $50. And then you go ahead and increase, by $20 the other side too. So the chair would get another $20. So both sides would go up $20. That's what I would. The other thing is too, so we can talk about this tonight and you could have things move forward, but Chad's gonna have to do there has to be an ordinance change. So there's really nothing that we can talk about, we can make some sense out of this. Budgeting wise, I can move forward with what you're telling me, so I can get it in the budget if we decide to go ahead with council mayor budget. It's easy enough for me to plump in. Sorry for those technical terms. It's easy for me to add an additional $2,000 to the council side or $3,000 to the council side and $2,000 to the mayor's side. If you give me just those kinds of dollars, I can add it in and then we can bring back what that would look like, thinking through the encouragement of attendance, meeting attendance, if that's what you want to do. If you want to add something to the base, then this would be the time to say that too. You know what, I'd like to add 500 or 1,000 to the base. In total, I'd like to see council go up by X and mayor go up by Y. Gives me, the ability to go ahead and budget for it. And then you guys can move forward next finance with what does this look like? Chad's got a lot of work to do with ordinance changes and things like that. So I guess that's just what I'm doing.
One thing I'd like to look at, and I guess I go in the file cabinets and look it up, but from 2018, when we went to the per meeting pay, from that point on till now, what percentage of that annual budget was the city using? Because in 2018, we had an attorney that discouraged people that weren't on the committee to coming to meetings, you know, and if we did, we came and we sat in the back of the room, you know, and there was a lot of this, you can't vote on this. And we had that period of time there. I don't know if anybody remembers that, but now it's like, so that percentage of that budget should be about the same since 2018. How much more are we using that? Because it seems like we have really good attendance now. I mean, unless somebody's got something going on. But yeah, I'll just be curious to look at that number from, not to linger in the past or anything, but we need to set a budget amount. If we're gonna increase anything, we need to stick within that budget, you know.
So we currently budget for salaries for the council at $49,000. We are at 7 months through at 58%. We are at 58%. So what's you're encouraging is happening because that budget is being utilized. Everything's budgeted at full capacity. So we're at like 57 and we should be approximately 58. You can see that people are attending meetings. Also, the mayor, we budget him at 8,600 and he is right there too at 54, almost 55%. So we budget at everybody coming to every single meeting. That's how you have to budget. And then you hope that that's what happens and you can see that's what's happening.
Then there's like we send flowers to somebody that passes or.
Oh, yeah.
And
Yeah.
schooling and stuff like that, that's all part of
That's
that.
totally separate from the dollar amount I'm giving you.
Yep.
So that's a different line item. This is salaries for the council, salaries for the mayor, not including fringe benefits. So those will have to go up slightly to 7.65 to fight the Met. So I would do that increase. I mean, so then we would plan for the change of the salaries actually in May of next year. So you're going to see a smaller increase in next year's budget and a larger increase in the 2024. So 23, 24 would be smaller, 25 would be bigger, just because it's May, like Chad had talked about.
So you asked for a recommendation. That's my recommendation. An extra $1,000 base pay for the councilman, extra $2,000 for the mayor, $40 a meeting, and a $60 for the chair. That's my recommendation. If you guys have any other ones, I think that's right in the realm of other communities and inflation.
On top of that, I'd like to see a yearly percentage raise to align with what staff gets. So if staff gets a 2% raise, council would get a 2% raise. That keeps-
Oh, every year moving forward is what you're
from-
talking.
Yeah,
Okay,
On the base or on total?
that's up for discussion. I just think that we need to see progression as well as what we thought with staff.
Yeah.
And what does everybody think? I mean, is that a good idea, bad idea? Like, yes, where do you want to see it?
I think the progression, the annual progression is a good idea. I mean, obviously, the rate hasn't changed since 2018. So, we're sitting here 15 years later without a pay raise, which does not put the $4,000 a year out of line at all, or the rate increases for meeting attendance or for the chair. I almost feel like it should be 20 per meeting and 25 for the chair in addition. So if the meeting goes up to, Judy, you said 50?
The meeting we're looking at currently 40 and the chair at 60 is what Mr. Roberts had.
That's what he had indicated. Was that what you had given us for numbers, though? You had given us 20 and 20, correct?
10, and I think I just went 10 and 10.
No, I
Okay, so
think you did 20.
I think you did
You
20 and
said
20.
50 and then
I think that's too much for the chair. So
you said 50 per meeting.
we get,
Gets you
we get
close.
35 now. You're saying raise it to 60?
But it's not like 60 in addition to the 40, it's
40
60
and 60.
Yeah.
Total.
60 for what?
to be the chair.
Sorry about it.
So $20 more.
So again, instead of getting $5, you're gonna get $25,
20.
$20.
$20. Oh, no, I mean.
I'm not a
you know,
chair, I
sometimes You
think,
come
but-
in here as chairman and stuff like that. Like you said, nobody does it for the money. I get that. Whatever you can feel comfortable with, talking to your constituents.
I just assume talk to somebody a little bit. I know what's gonna say when they're gonna say you're voting yourself a raise. I mean, I always hate that idea that somebody's gonna say, well, shit, I wish I could vote myself a raise in every time too. I would have liked to seen it progressive, like we'd go up 3% or something. I'd have rather seen something like that. That doesn't look like you're giving yourself a raise, but it looks like everybody else is getting that. But all of a sudden now we get a raise.
I know that says May, that it goes into effect, but so you're not voting yourself a raise. I don't know that anybody that was elected this year
Can't get it.
can't get it till the following May.
Yeah.
Can't get it till you're reelected.
Yes, so you can't, so you're not voting yourself a raise, right?
Yeah.
You gotta get reelected.
run.
I realize that. I realize that.
And you're putting the wages. Same as when we looked at the city wages. Did all that work. Chad did all the work. Spent almost a year working on that. That's where we're at with this, doing the same thing. And now they're on a gradual step process to keep them in the market. That's where Mr. Roberts is coming and asking to put council back in the market of where they should be. So it's just making things right, the way I see it, the way you're coming across.
Well-
Not necessarily giving yourself a raise. I mean, if somebody else was out there could do it, but we're the ones in the seats that need to have that discussion.
well, on that note, what would it be? What would it be if at $30 per meeting from 2018 to now at that 2% increase per year? What would that math be? That compounded math is a little bit more than I'm calculating in my head. But I mean,
I mean, I'm just saying,
I
we
think-
just had all this discussion with the city employees that the last couple of years have been crazy with wages. I mean, you can't just do a 2%.
Right.
I mean,
Right. Once you figure out where the pay scale should be, then it should be all right on the
and I
progression.
mean, you got cities, around us, Greenville, $500 a month, with $6,000 base plus $35 a meeting. Lebanon, the same, $5,000 a year, $35 a meeting, they're unincorporated. So I mean, yeah, and then you got all these little piddly towns, but I mean, we're 7,000 strong, I mean,
Greenville
they also,
twice the size of
so do 92% of them, like the city did.
Where's the happy medium, do you think, in between the two numbers there? Yeah, Bob, you were pretty much saying 20? No, not 20. Well, what were your numbers that you suggested?
For chair. We were looking at $30 a meeting, 35 for chair, and you were saying 50. Tim, you were at 50 a meeting,
No, Tim wanted
For
40.
I said 40 and 60.
40 and 60. See, the 40, I guess I could see that, but just the 60 for chair, I just think that's.
You
too
don't put
much.
in $20 worth of time into your planning your meeting. You know what I'm saying? Economic development. I put in hours like looking stuff up. And then I got the paycheck. It's like $5. I'm like, why would I do this?
The
You
only
know what I
thing,
mean? Like,
the only other thing you look at is sometimes you come in here for a meeting and you're only in there for 15 minutes. So people look at that and they say, "Huh, that's a pretty good
it's gonna
job."
encourage the chairs to do more work.
I realize that. I just think that's too much for the chair. I agree with the other one, I guess, to a point, but I don't know.
the finance chair has been in here quite a bit on paid meetings. Just gonna throw that out there.
I think the finance chairs probably come in the most for meetings, and not to,
It's all good. I signed up for it.
but.
But I don't think that
But just like,
paying the
we-
one person the extra $20 for that meeting a month is out of line.
just like we were having a hard time finding employees for the city, we're having a hard time finding city councilmen and mayor and whatever. I mean, I want the best of the best in town to be in these chairs.
I don't think they have trouble finding. We've only had what, once? Twice, as long as I've been here, that we've had to add somebody that did not go out and get themselves elected. So I can't really say we're having such a hard time getting people to be aldermen. Every year we get people, we're well represented. I can only remember twice that we had to go out and, other than what was elected and decided to run, that we've had to go out and find somebody to be an alternate. So to say that we're having such a hard time, if somebody wants to be an alternate, all they gotta do is take out the papers. I think a lot of people just don't want to be.
What do you think, John?
Well, I'll say the same thing I said in 2018, I guess. If somebody thinks it's too much money, they can always donate it back or pitch into a cause, youth sports, library, whatever. I'm okay with where we're at, but I also see mayors, I see everybody's point that, you know, if you don't look at things like this every 5 to 6 years, you're gonna be in the same place and then you're gonna be spending a whole year, or you're gonna be racking your brain and you're gonna be saying, how can we take this kind of a budget increase in a single year? So I think if there is a motion coming out of this thing tonight, I think it's to direct the finance director to lay out the financial options for us, and then we kick it around and vote on it of an actual concrete number where we have it right here.
We can't make a motion on this tonight, though.
No.
No, but
It's just
But we can direct the finance director
Judy to
to.
find out what the raise would be. to the
So
city.
if I'm understanding correctly, then this is only gonna affect from May of next year, but only 5 aldermen.
No, it'd be everyone, but it wouldn't be enacted until May for everyone.
So then they can. So the ones that were elected this, no, because
You wouldn't get the pay raise
I
till
don't think you get
next
the pay
year.
raise until you get reelected.
And if you're running for reelection, and you don't get reelected, you won't get the raise. The other guy will.
Oh, I know,
So
but
that,
but those of you that were elected
This
this year
get
are gonna
them
have to wait
till May,
the following May.
right? Yeah.
But you
right
get
next-
reelected again,
next year.
so for the budget
Right, next
standpoint,
year.
this is only gonna be half in May of this year.
Correct.
And it'll still be another half in 2025.
correct.
Where's that? I'm not understanding where
It's a
that's
city
at.
ordinance. That you
I think
can't.
it's state statute.
get a
I think
raise.
it's state that you can't get yourself a raise.
Okay,
Why
So
don't
because
we-
we're half and half,
We'll look into that for sure. We don't have to sit there and argue at that point tonight. We'll look at the legal aspect of that.
So am I understanding this right? If they decide on a raise, then after that, every year there will be a percentage that you get a raise instead of going through this again?
we would like to set it up that way,
That was
yes.
an option discussed.
That's the way I wish it would have been set up that a long time ago. Then we
We wouldn't have this discussion
Exactly. I
right
agree with
here.
you, Bob. 100%.
That, everybody would understand that. That's
And
what
it's-
I would have liked to see, but it wasn't.
It's a smart thing to do because then we're not in the same position. We were with all the city workers this year. We're, for the last couple of years, they're so far behind that you're scrambling to do it. This gives Judy concrete numbers going forward of what everything's gonna be.
All right, can we move along a little bit?
Breathe, Tim, breathe.
Judy, do you have good direction?
A lot to talk about, so.
Okay.
I think we'll crunch some options for you eat on it, chew on it a little bit more. We'll look at the options for when the pay is enacted for everyone. We'll get legal opinion on that. And I guess if we'll just put some information together based on what you guys talked about right now. 1,000, the 2,000, the 40, the 60.
We're
You guys
talking
want the-
15,000-ish with just mine.
You're crunching numbers there.
Yeah.
Like Mr. Fisher said, it's a little bit better when you
Forget the
have
bonus for the
have that
longest
laid out in front of you to be able to see it on paper instead of talking about it. I mean, we got to that collectively. I agreed to let these.
I think it would be really nice to, and I know it's additional work, but it would really nice to see if a 2% or 2.5% or whatever the average percentage wage increase has been since 2018. Where would we be at today had that happen? So it might be easier to swallow with these numbers then.
So what is the average of a council person right now? 3,000 a year?
Well, if they attend the 6 meetings per month, this is what 3,000 plus the 6 would be. So you're right around that 5,200.
One more thing, I would like to see the commission members get paid too. So can you look into that as well?
Next.
Okay, sorry.
We have to talk about
Okay.
that. So we'll crunch some numbers on percentage increases. We'll look at when this is enacted, and we'll kind of come up with some more options for the next meeting to look at.
Thank you.
If you have any thoughts about it, reach out to Judy or I in the next month. Before the next
And we
meeting.
have enough time, if we look at that in October, to do adjustments within the budget
Yep.
or
And
presentation.
we're just gonna budget a budget amount, what the actual pay is. can be determined. Another ask was poll workers. So right now, our poll workers make $147 a day. The chiefs make $175 per day. And then they are compensated $10 per hour for training. So you can kind of see, these are the communities underneath us that are making about $10 per hour. If you take this day wage, Nicole reports that they're averagely working about 14 hours a day. So that hourly rate comes down to about $10.50 or $12.50 for the chiefs. Polling places based on a full day. You can kind of see that comparison here. And then see the comparisons forward there. So again, I think we're just centered, below where the center point is in here. I don't know if you have the same thought process where you want to go up $1 or $2. Again, we can look at doing a percentage increase with these as well. So we're not trying to play catch up after 5 years. We have been doing.
You got Town of Liberty there, that's right next to us, that's a township making 12.15. I don't think that's out of a 14-hour day, I mean, that's a long day. I mean, it's not just. I don't think they're only doing it once, twice, 3 times a year. It's not like it's gonna be a huge hit to the budget. I think 12.15 is out of the realm of, decency.
They definitely deserve a raise.
Oh, yes, they do.
Like I said,
Never done it, but my wife has, and she quit. because of such a day. I know it's a long day.
Well, it's not just a long day, considering the current affairs in the last several years surrounding elections and integrity. That has become a lot of stress. And especially for people, we all know who these people are that are doing this. So we know their levels of integrity are beyond repute. So, but to have to deal with just the public opinion and just quite honestly, the smearing of their integrity deserves a pay increase.
Do you guys have any history on this one? When the last time they've gotten a raise?
This one I don't. It's not the ordinance.
So Do you use two?
That one's much more current.
This
This
one?
has been done, yeah. This has been done much more often than the others. I remember Sue doing this in my mind,
We
like
do-
within the last 8 years.
Trying to keep getting.
Yeah,
poll workers. to
because
work.
you have to be, yeah, you have to keep these up.
So it's 2 people per polling place? Is that, or 2 chiefs? What is that CLS per polling place? What is that?
2 chiefs. And one of the things to keep in mind too, is that we have 5 polling places, which Nicole thinks that's a lot. She would like to reduce that. Not, other communities our size really don't have 5. They might have 2-ish, 3-ish. So in the future, she's talked about trying to reduce that to make it a little bit less hectic and spreading out over town. That's a different conversation. But I think she has 2 chiefs, and didn't she say there was an odd number of poll workers? I know Tim, but not to put you on the spot, but you've worked it. I don't know if you recall how many people were there kind of.
How many workers are, it depends upon the election. If it's a major election, you get have 5, but if it's just a primary, it's like 3.
You run the numbers for 12 for the poll workers and 15 for the chief.
Like I said, you're only gonna have 4 elections at most a year.
168 versus 9.
No, I mean for the next
19
meeting, so we
bucks.
can go through. it.
Okay, all right, you got it. Yeah, then you're gonna be 12 and 15 for chief. All right.
Yeah, I think so. I don't.
If you're trying, well, you're at 168, so, and it was at 179.
If you like those numbers, someone can make a motion to direct Judy to budget at those numbers and kind of see where that's at for the overall budget.
I thought we couldn't make a motion.
On this week. It's not an ordinance change.
Okay.
This one's not designated.
Right, we
ordinance.
can go
Oh,
ahead
we can
and
just
do-
go ahead and do it.
Yep.
Yes,
Oh.
this one you can do.
That's even better.
So I'll make that motion.
Second it. Oh, for $12.15?
12 and 15.
I'd second that.
Motion's been made by Tim, seconded by Bob. All those in favor?
I,
Opposed? Motion carried.
before we roll on, I'd like to answer Belinda's question from before. Did a little quick math on that. I think it was 5,200 for all the persons. At a 3% raise on average is $780. But I did not take that year by year, so there is, I'm gonna say it's gonna average out about 1,000.
Thank you.
And that goes on 5 years since.
Judy will crunch those numbers too. The last discussion with this is the citizen member pay. So right now, this is in the ordinance as you see it right now. Citizen members, $30 per meeting attended for the Parks and Rec Committee and Economic Development Committee. We have several on the Parks and Rec Committee and I think 2 in the Parks and Rec Committee and 3 on Economic Development, if I'm thinking right off the top of my head. We did get a question from someone on the Planning Commission. Why are some committees paid, some are not? Police and Fire Commission is not, Cemetery Commission is not, Planning Commission, citizen members are not, Utility Commission members are, they're financed out of the utility budget. But that said, I have no rhyme or reason why some are, some aren't. I also did poll some other communities, if they pay their citizen members for being on committees. Clintonville, yes. Wapaka, no. Waiwega, yes. Hortonville, no. Greenville, I found out that Planning Commission is for sure. I don't know about any other committees. And Shawano is yes, with a couple of exceptions. They got a business improvement district that is not. And it sounds like the redevelopment authority is not. So that's kind of all over the board too. There's no consistent rhyme or reason. I asked Chief, he had a chief's meeting in the valley. He asked if other police chiefs, if their police and fire commissions were paid. Grand Chute, Kakana were the only two out of that group of the Fox Valley, that meeting, that did say that they compensate their PFC members. So the question comes down to, I don't have a rhyme or reason why Parks and Rec and Economic Development Committee members were compensated and Planning Commission was not. We have not polled Library and Museum Board, we've not polled our Police and Fire Commission or the Cemetery Commission here of their thoughts. Obviously, if that happens, that would go in their budgets. Library budget would have to, that would come out of library budget or Police and Fire Commission. I don't know what your thoughts are for compensating.
So what I'm seeing is that our citizen members are compensated if they're on a committee, but not on a commission,
Except utility commission.
except utility commission, because that comes out of their own budget. So,
I don't know why we don't just add the planning commission, take that little line, out of it, move it up. Put them with the rest of them.
So the way I'm understanding it too, let's say like the Library and Museum Commission. I don't see why they couldn't choose and vote to pay their commissioners out of
correct,
their budget.
correct.
This is specifically talking about
What the city pays out of our budget.
Planning commission.
planning commission.
Just like the police and fire commission, that should be
Out of their
out
budget.
of their budget.
Correct.
If, I mean, you have to change ordinances and stuff. I think it's been asked before and people's like, well, that's just how the ordinance is, or it's how it's set up. So you have to have Keith look at it too, make sure that there's not some kind of thing barring us from paying somebody on a commission.
I think now is a good time to do it if we're gonna redo the ordinance anyway.
I think, we all have nostalgia and like everybody wants to believe that we're here for the goodness of our hearts and we all volunteer time, but it's not the 1950s anymore. People don't do that. People, when they go somewhere, they want to be compensated. I'm sorry, that's just reality. And I think that if they're driving here, taking the time out of their day, I don't see why not they be compensated. I mean, you're doing a job for the city.
The planning commission does a lot of work.
Mhm.
They do a lot of work and they're taking on a lot. I mean, there's so much that's going to be happening moving forward.
Not
They
saying the other commissions don't do a lot of work.
No, no, I know, but there's a lot of big project work coming from the planning commission. All of the, economic development, parks and recs, they're paid. The other commissions, I agree, also, they do a lot of work too, but they're not paid by us.
They
This
have
is
their
the
own
only one that
budgets.
is not paid by us, and they do a lot of work.
So I guess we'd like to see we advise the city, since this is a ordinance change, to have the planning commission get paid the same as the economic development and park and rec. And I would recommend we go up to $40 as well with other.
Is the difference the fact that commissions their decisions do not come to council?
Planning.
Some stuff out of the planning comes to council to get
It's like
approved.
an ordinance,
Yeah,
that's gotta be presented to city council. But there's other things that police and fire commission, they're their own government body.
As such, that's probably why that is set up that way, or it was set up that way.
So if I heard it right, there's a motion to direct staff to create an ordinance, change the ordinance to present, to allow compensation for planning commission and the other citizen members at $40 per meeting.
Directing staff, I'm not making a
Directing,
motion.
We don't have a motion.
I can't make a motion. Because it's an ordinance change.
Well, you can direct staff, you can make a motion to
I'm
direct staff.
Directing staff. Wait a minute.
Yeah, we'd just like to see that in with the rest of the compensation that we're doing right now.
Yes.
And yeah, it would be the same pay. We're not gonna
we
pay
want
them
to make,
less.
we want to make a motion that the planning commission is considered in the Rate the citizen member raises.
That's what he,
Right now, that's
That's-
the direction we're sending them, and they're gonna take it all back there, figured out. Next month, we'll come back and then we can move forward.
you'll have a clear ordinance to review
Okay.
what the change would be. Based on that feedback.
I agree with that. I think them people should be paid like the rest of them are. Like you said, they come to meetings. Yeah, they should be paid.
I think that's it for that one.
Good check.
That's
Got 'em all?
before.
Oh, we gotta set the 2024 budget presentation date. Is that that's the date?
But that's what I would like the date to be. So hoping y'all check your calendars, and we do not have finance that first Wednesday in November. And by then we should have our assessed value. So that way we can do, what is the tax rate gonna look like instead of trying to guess. When I talked to my chair, he had indicated, why don't you just push it up instead of worrying about what that's gonna look like and having any issues. So Wednesday, November 1st would be the budget presentation, and then the following week, we would actually have our finance committee meeting. So it'd be 2 Wednesdays. So if that works for everyone, just so you know, I do need a majority, a super majority for budget. So we have to have 8 of the 10 from the mayor.
So you're setting finance meeting to 8?
The finance meeting would be the 8th because of the way the Tuesdays fall. So I chose the first, oh, Chad's got it up there. So because the Tuesday, it's always the second, the Wednesday prior to the third Tuesday is the way that it's written. So the first is open. So if that works for everyone, then I will move forward with getting everything prepared for that meeting. Not just myself, but many others in the office.
All right, moving on to the finance director's report.
We are currently looking at the month of July. So with our expenditures, if we're looking at a percentage, we're at about 58%. And I'd like to go to this one. And you can see most are in alignment. Insurance is high, again, because we pay that at the beginning of the year and it's coming, used to be over 100%. And you can see as time goes on, it'll continue to tick down actually in percentage. And then head up to 100% as we go towards the end of the year, because I do bill the utilities in particular for their portion of the insurance that we pay and then they pay us back for. Cable 3 has all of the infrastructure going on in this room, and a lot of that will come out of the capital or out of their assigned but fund balance eventually. But everyone else, social services is high only because a lot of that budget is our fireworks that's already been spent, and that comes in on the revenue side. Equipment maintenance, we are at 79%. We have had some huge expenditures this year in our fire department. They've had a lot of, and there's nothing we can do about that. You have got to have people going out and taking care of people, and you have to have those things functional. So if something goes down in the fire department and the chief comes and says, I need to get something fixed, you have to get those things fixed just to start, these are emergency personnel. Besides that, and we talked about this, sorry, the cost of maintaining our equipment is just skyrocketed along with, as we talk about wages, this is another area. So we will be looking at increasing this dollar amount going into next year's budget, so you can be ready for me to talk about that once we hit that budget process in November. So everything else looks on, we just have a small amount of debt service that we have to pay yet. I don't expect anything to actually go over budget unless we have assigned money set aside for that purpose. Any questions on anything in particular on the expenditure side? Then we'll move on to the revenue side. And again, everything is looking really good on our expenditure side. We talked about the interest, and here we're sitting at 184% of collection this year, which is awesome. He had indicated we were about 100 and some in decrease last year, based mostly on market value. All of that has come back. Again, I'm not going to guarantee anything. I don't have a crystal ball when it comes to market values and those swings. But I anticipate at the end of the year that we will see the opposite happening, which happens sometimes. So you'll see it down, and then you'll see it come back up. So then we'll have a positive 154,000 at the end of the year with the swing in market value. And this is not a correct percentage. I apologize for that. I did see that earlier and I did not get to correct it, but we do collect a very small portion of our shared revenue in July, and you can see that booked here. It's not 194% of 2.1 million, but that is sitting here in the correct dollar amount. Property taxes, you'll see next month will be collected in full. We're fortunate enough where we collect the first and our counties collect the second, and then they pay us in full and they have to worry about all the collections and all those things on the other end. So I like that. So we're looking good, collected a little bit more in special assessments. Again, revenues, I also anticipate that we will collect in full for 2023. Any questions on any of those? Otherwise, we will move on to assigned and unassigned fund balance. And one of the things that Brent did point out is that we have a lot of money that we have earmarked for a particular purpose, and this is what he was talking about. So we have capital projects reserves, and at the beginning of the year, they're at 757,000, and we anticipate spending those dollars, and that's where you can see the expenditure anticipated just within this budget is 783,000. So when we're talking about $1 million in the audit that he points out, it's really not a lot of money when you're looking at capital projects. Cable TV is another area that is set aside, debt service. So we have a lot of things set aside for particular purposes that either you as of a committee have decided to set it aside for, or we have gotten money for a particular purpose. And that's why I put those dollars in here so that we don't forget exactly where those dollars should be spent. Like Mr. Cross left dollars in here. Not seeing it right now, but right here.
10,000.
So we know that that money has to be used within that park. And then we have our unassigned fund balance. And again, like he had indicated, we are in very healthy shape when it comes to our unassigned fund balance compared to our policy of 25% of operational expenses. Any questions on any of those fund balances? And we move on to the ever popular wheel tax. And the actual money collected with our wheel tax is $70,000. We anticipate 130. And again, right now, there's nothing in particular, but we know something will pop up by the end of the year, and or we will utilize these dollars and put it together and have the additional $260 going into next year. So I'm guaranteed that this will be something that has to do with the project. Then I inserted our because I always think this is good when you have constituents or people or citizens saying, what are you doing? And then you can pull this out and say, here's our list of projects that we're moving forward within the next, actually up to 2027. So we do have our eye on road construction and other items going on within the city. So you can show them what streets are being what streets we're moving forward on in the future. Because I know one of the big ones is Oshkosh Street, and that's listed on there. And they're happy to see that that's actually going to be done in 2025. And part of why it has to be done is we have a grant that needs to be spent. So besides the dollars that, and that's always a positive thing too, is to show them the revenue side here where there's an 80-20 grant received for our downtown project, and then the is it the what's the acronym? I can't see it. For the Oshkosh Street.
LRIP.
There you go. Okay. I don't know why that's funny like that. So I provide this to you for informational purposes, and then any other projects we can have, we're thinking about down here so that we don't lose track of those also. And then my report for the month. So, I finalized a lot of budget information and the packet was sent out to all department heads. The insurance information is due on an annual basis to CIVMIC, so I did that. It includes our general liability fleet, along with the utility information, so I coordinate with them. And then we provide payroll estimates for our workers' comp premium, and then they send us those premium estimates back so that I have that available for 2024, and I have already received that. Chad, Jay and I spent time, if you know, on the health insurance, looking at alternatives and percentages. It's just Stephanie, Jill, and I are working to set up the employee meetings, which actually, depending on what happens tonight, we have set up for tomorrow. We did that for purposes of just continuing to move forward. We understand that that was your decision and not our decision. And we would have doubled back and made changes had that been necessary, or have that, or if we need to make those changes. So we worked on getting that ready to go. So Stephanie actually already has sent out information to all of our employees so that they could set some time aside, because as you know, if that choice is made for us to be able to offer those 3 choices to the employees, we have to have them moving forward and making the decision about what plan they're going to pick for next year. So we can get that moving forward. Robert Benton and I met to go through the sewage plant budget. I met with a lot of department heads actually in the last couple of weeks about their budget. I worked with Stephanie and Jill on getting the capital projects list on the payroll time card keeping system, as Chad had asked us to do. Like I said, I spent a lot of time answering last minute questions on the audit. He had, like he said, staff changes, and then the new staff person is taking over, and then you end up answering these questions a second time, or showing them where you already provided that information. I did attend a meeting, a community treasurers meeting on the Act 12, and we're still waiting for a lot of clarification on the changes within that act. And then I am doing some training in between when Jill is not around with Stephanie. And this past time I was on 20th bills, which includes all of our invoices, our large invoices when it comes to human resources on health insurance, life insurance, dental insurance, and vision, and our Wisconsin retirement system. So what we do is we tie the billing system to the computer system to the invoice and make sure everything's tying up. And it does take quite a bit of time. That's that. And everything else. Anyway.
Thank you, Judy. If not, is there any other questions? Not, I'd need a motion to adjourn.
Motion to adjourn.
Second. Motion made by Tim, seconded by John. All those in favor?
Aye.
Opposed? You're adjourned.
Special council meeting.
Go to the bathroom before we.
I know.
After a bathroom break.
10, we'll call the special common council meeting in order. Roll call has been taken. We need a motion to adopt the agenda.
Second.
It's been made, second.
Second.
By Mr. Roberts. All in favor, say aye.
Aye.
Opposed? Motion carried. All right, line 2, review and consider health insurance plan for 2024. Judy, would you like to take
Yep.
it over?
Sure. So I should have been more explicit when I put this line item on here. But what will be looking to approve is the option for the employees to consider the 3 plans. And then also so we would be looking for an approval of Robin Health Partners for the 3 plans for the employees to choose from. And then also to continue with Delta Dental and Delta Vision for 2024. And those premiums are unchanged for both. The vision is all on the employee, but the premiums are unchanged and the plan is unchanged. But that we're allowed to continue with that program for Delta Dental and Vision.
It's a mouthful. I'll make that motion.
Second.
Motion been made and seconded. Any further discussion? All right, we'll do a roll call vote. Mike Barrington,
Yes.
Bob Bisall,
Yes.
Tim Roberts,
Yes.
John Fisher,
Yes.
Dennis Erding,
Yes.
John Hess,
Yes.
David Dorsey,
Yes.
Linda Croy,
Yes.
Charlene Magowski.
Yes.
That motion is carried by all. All right, next on the agenda is adjournment.
Make
So
motion to adjourn.
moved.
Second.
Motion been made and seconded. All in